Hello, thank you for joining us for a discussion on the microbiome and kidney stone disease. My name is Manoj Monga. I'm the director of the Endourology and Stone Center at the Cleveland Clinic, and I'm joined today by Dr. Aaron Miller, who is our director of our translational research program and is driving new frontiers into evaluating the role of the microbiome in stones. Historically, both bacteria and stones have intersected in many different ways. As clinicians, we know that infections can lead to stones, can complicate stones, can complicate surgeries both before and after we perform them. Now, from this standpoint, clinicians are acutely aware of the role that microbiomes play. In addition, there's been much research and consideration provided to the role that the microbiome may play in the pathogenesis of stone disease. And lastly, we're looking forward to the ongoing research into the microbiome to help us identify novel approaches to diagnosing stones, preventing stones, and helping our patients who suffer from stone disease. With this brief introduction, I'll turn it over now to Dr. Aaron Miller, who will discuss some of the recent findings from his lab.
Hi, thank you. So in terms of microbiome research, there's several questions that we want to ask to determine if the microbiome contributes to disease. And so first, we want to know, does the microbiome actually contribute to a particular disease? For urinary stone disease, there's mounting evidence that the microbiome does in fact contribute to urinary stone disease. Several recent studies have been published showing that urinary stone disease exhibits a significant positive correlation to antibiotic use. And so what this tells us is that potentially the microbiome contributes to urinary stone disease through the loss of bacteria within the microbiome that would normally potentially prevent urinary stone disease. In addition to this, there's been considerable amount of work into oxalate metabolism within the gut. And so oxalate is one of the most common components found within kidney stones. And there's numerous oxalate work out of my lab shows that it's not as simple as just oxalate degrading bacteria, but rather that there's considerable cooperation among microbes within the gut that facilitates oxalate metabolism. And so it seems to be much more broad than oxalate metabolism alone. Other recent studies from the gut microbiome have shown that the microbiome correlates with a number of other risk factors for urinary stone disease. This includes oxalate transportation within the intestine, urinary calcium, pH levels, sodium, magnesium, and factors. And so there is strong evidence that the microbiome does contribute to urinary stone disease. And so one of the questions that my lab wanted to ask is which site of activity was most important? And so we conducted a comparative analysis of the gut microbiome, the urinary tract microbiome, and actually the microbiome from stones themselves. And specifically what we found by looking at these three different areas is that the urinary tract microbiome by far and away separated out our healthy controls from our stones group much more than the gut microbiome did. And so while the gut microbiome may be important, stone prevention or actually the onset of disease, it appears that the urinary tract microbiome is more important. And specifically what we found was that in our healthy group, there is one specific species of lactobacillus that was by far and away much more prevalent in our healthy cohort and depleted in our stones cohort. And what's interesting about it is the species, it's called Lactobacillus crispatus, has been successfully used in clinical studies to prevent recurrent episodes of urinary tract infection. And so it seems like this one species is important for overall urinary tract health. And so we're continuing to following up on that species and its role in stone formation, but we're particularly interested in these three metabolites that are currently unknown that we found and that we think are really important for the prevention of stones. On the flip side of that, in that same study, we found one specific species or one specific strain of E. coli that was present in about 10% of an average of the relative abundance of 10% of the microbial community from stones themselves. And this was across calcium oxalate, calcium phosphate, as well as uric acid stones. And so we think plays an important role for the formation of stones in general. So through this work, we've identified, basically one species that we think protect against stones, and one species that we think really is the aggregation of stones. And we also have a very short list of metabolites that we think mediates these different processes. So our data correlation between antibiotic use and the onset of urinary stone disease, that perhaps a more rational or guided use or strategy to minimizing antibiotic use in general might help to prevent the onset of urinary stone disease. But in lieu of this, there are specific species of bacteria that we think can actually help to prevent urinary stone disease, such as this lactobacillus crispatus.
Well, Aaron, we really appreciate you sharing some of this novel research that you're conducting at the Cleveland Clinic. It's very exciting that not only will you be able to identify some of the pathogenesis that previously has eluded us, but also potential novel diagnostic tests, as well as therapeutics that can change the way we practice in the future. We thank you for joining us for this discussion and hope to be able to share more with you soon.